And for more on this story, we're joined by Sridhar Venkatapuram. He's a senior lecturer in global health and philosophy at King's College in London. Thanks so much for joining us. And as we just heard in that report, it'll be 9 to 12 months before those vaccines will be produced at the hub in South Africa. That puts us well into next year. And meanwhile, infections and deaths are up by 40% just in the past week. So won't Africa have to depend on help from elsewhere to get its population vaccinated?
Yeah, you're absolutely right. I just wanted to add to your previous reporter's story on that, is that this mRNA technology hub will be set up and ready to go in 9 months if the existing two companies that have the mRNA vaccines, Moderna and Pfizer, provide the formula or the methodology for that vaccines. If they do not, that means that there's other companies that are still trying to develop these vaccines in other countries that would then be asked to provide this technology transfer. So not only do we have to see if these two companies will be providing that technology for this technology hub, you are perfectly correct in saying that until those 9 months, other countries will have to be helping with providing those vaccines, or COVAX will have to be providing the doses as well.
Yeah, so it sounds like there's still some big questions to be answered. From your understanding, how would this vaccine hub work? Is the WHO handing over the production of vaccines to South Africa, or is this truly a partnership between the two?
So the WHO put out a call, I believe, in early April for all countries or any countries to become vaccine manufacturing hubs, specifically these mRNA vaccine manufacturing hubs. And the reason is because this new technology, there's different kinds of vaccines, but this mRNA type of vaccine has great potential for addressing many other viruses. And so the idea is that more countries, particularly in Africa and other low and middle income countries, would set up these kinds of hubs so they can begin producing their own vaccines.
Well, so many countries in the West, as we know, are well on their way to vaccinating their populations, while Africa is dragging behind. The South African president, has said it's a form of vaccine apartheid. Do you agree with that?
I do. I mean, I think that he has been at the forefront of really presenting the stark inequity that has, that is reflected by the way that the vaccines have been produced, but also just really hoarded by rich countries. And now they're being used in diplomatic games in order to ensure that they have different kinds of influence in different spheres, and also playing them against China. So, but meanwhile, these people in Africa are dying, as well as in other countries, including India and Brazil. So I do think that he's being very stark, but also very real, saying that it seems to be that the values of people in some places are valued more than others. If we didn't, then we would ensure that everybody has access to these vaccines, particularly the countries that are dealing with the most deaths and the most cases.
What about the COVAX program? This was set up to help poorer countries get the vaccine. What's the status there? Are other countries contributing to that? Are they doing enough to help?
So what's happened with COVAX is that it was a great idea, and it was supposed to be able to work with profit-making companies and protect their IP and help them make profit, while at the same time providing sufficient amounts of vaccines to all low and middle income countries. What ended up happening is that despite all the pledges that were made by rich countries, the countries have not actually put money into COVAX. Rather, they've sidestepped COVAX and bought their own vaccines directly from the companies and have actually ordered many more. So at this point, COVAX simply does not have the money it needs in order to buy enough vaccines to provide to low and middle income countries.